ChaRLian TV. ChaRLian.
Yeah.
ChaRLian. ChaRLian. ChaRLian TV.
Hi everyone at home, this is ChaRLianTV and we are at the World Heart Day 2019. Let's get to hear what the organizers and the participants have to say about the World Heart Day. Thank you.
Sometimes when you boil the meat, you don't see the oil on the stove. But then you still have to add more oil because it has some cream. So this is where the risk comes. For most of us that buy food outside, you don't have control. You have to eat what you see. And that's why for you to make a difference, you need to make a conscious effort. Of course, we use it gradually, but then you need to also make effort. If it's to make some of your food from home or whichever way, get a sauce. I know there are some issues that now, becoming more providing healthier portion and all that. So we need to pay attention to this. Because the truth is that once something happens to your health, and if you're unlucky and it's irreversible, then those things you don't want to do, you will end up doing it. So why don't you make the choice when you still have the opportunity to? And a lot of us don't even understand that all these things we are doing are investments. Whatever it is you are eating now, in your future years, it pops up.
Good afternoon, sir.
Good afternoon.
Can you please introduce yourself?
Absolutely. My name is Dr. Majakodumi.
And what can you say about today's program?
Well, I think today's program is very helpful, and I think it's a welcome thing that we need a lot more of. We all recognize that one of the biggest problems in relation to heart disease is awareness. People not really being aware of what they should be looking out for and what things that they are able to do. And what I think today's program has done is through a team of various experts has been able to educate the attendants who are here about things that they need to be aware of, things that they are able to do, and the interventions that are actually available that can all help them live active and healthier lives.
And what can you say, sir, about, nowadays we don't really care about our health. And what can you tell the viewers at home to do about their health?
Okay. So, there are a number of things that everybody is concentrating on today, from work and personal relationships and all manner of things that people are going through. But I think most of them, if they stop to think about it for a minute, if you are not healthy, that overtakes everything else.
Yeah.
So health is the number one thing that we all need to be spending most of our time concentrating on and ensuring that we do as much as possible to stay healthy, because without health, all the other priorities in life cannot be accomplished.
Thank you very much, sir. We hope you enjoyed the program.
I absolutely did. Thanks for the invitation.
But here you can walk into the pharmacy and buy pretty much anything you want. In terms of other allied healthcare professionals, one of the things that we are very stubborn with in our hospital is if someone comes and they are taking a drug from somebody else, I am not going to talk to you. I am not going to give you any medication until I know what else you are taking. Because otherwise I can't treat you. And a lot of people come and see me and say, "Oh, doctor, I've seen you. I've spent all this money. You've run all these tests. Aren't you going to give me any drugs?" And I say, "No, I'm not going to give you anything because I don't know what's wrong with you yet. So I'm not, if I don't know what I'm treating, what am I giving you drugs for?" We do it differently. So again, with your practice, you see people and you know that if they don't come to you with a medical report or list of drugs that they are taking, refuse to treat them. Say no, you have to go home and come back with your drugs. We have to, if you don't draw the line, these kinds of drug interactions and iatrogenic things will happen all the time. I refuse to treat people. Go back, get your drugs, come back before we treat you.
Good afternoon, ma'am.
Hi, good afternoon.
Can you please introduce yourself?
So my name is Fola Shadiba Batunde.
And what can you say about today's program?
Well, I think it's a very, very good program to sensitize people and create more awareness about health issues around us and globally.
And what can you say about our health when it comes to our heart and our health? How can we live healthy in life?
Well, I think we all have the responsibility to invest more into our health, just to ensure that every organ in our body works very well, especially the heart also, because the heart is central to every other organ functioning in the body. But then I'm coming in from the angle of nutrition. We need to pay more attention to the things we put into our mouth, the kind of food we eat, every now and then, the fast food, the fried food, the fatty food, all these are things that predisposes us to risk factors that can, end up making us have heart disease. So we need to pay more attention to them, add a lot of fruits and vegetables to our meals, and then include more healthy fats.
And what advice do you have for our viewers watching us at home?
Well, I would say that everybody needs to take effort, put in more effort into eating something that is quality, or even aside the dietary aspect, take effort, go for checkup, do screening. Health is important. Whatever it is you're doing, whatever career you're chasing, being, all those things, your health matters a lot. So if something goes wrong, the things you're running after would have to stop. And then you have to pay attention to your health. So before it gets to that, you need to create the time, invest time into your own health, and make sure that everything goes well. Then you can even be more productive than you can ever think of.
I hope you really enjoyed today's program.
Yes, I really enjoyed it. I'm very glad I was invited to come and speak to, so thank you.
Can you please introduce yourself?
Okay, my name is Abdulbasit Shijuade Akemi Shiloko. I'm the founder of Health Volunteers Nigeria Initiative, the organization co-jointly organizing the Heart Dialogue 2019, which is holding today.
And what can you say about the World Heart Day?
Well, the World Heart Day is an event put together by the World Heart Federation and adopted by the World Health Organization and the United Nations. It's a day set to raise awareness of cardiovascular diseases so that people around the world can know the different types of heart diseases that exist and how to really prevent them and know what actually puts them at risk of these diseases. So the issues surrounding the risk are issues of nutrition, issues of body fitness, issues of even checking your numbers, knowing your blood pressure, your cholesterol level, and thereabout. So I think the World Heart Day is a worthy day that's been put aside, and I am so glad that a day like this has come forward to raise this kind of awareness.
And how do you want to tell people watching us at home on how to take care of their heart?
Well, for all of us watching us at home, I want to tell you that first thing first, you should have at least 30 minutes of daily physical activities. Use the stairs more instead of saying that you are taking bike all the time. Use the stairs, trek. Trek at least once in a while, just trek. Do the normal trekking on the road. It won't kill you now. So aside that, you eat heart healthy foods, you eat more fruits and vegetables instead of, and then you avoid all the fried foods. You know, we fry our dodo, fry our meat, fry our all the fried things that we eat. So aside all this, we should also check our numbers. Do not waste time in checking your blood pressure. Check your blood pressure at least once in 2 weeks. Right? So if you have a family history of cardiovascular diseases, know that you even have to check it more often. Then if you have diabetes, know that you are at risk of heart disease. So some of these things are the things I would want to advise all of us at home. Then if you now discover that you have a cardiovascular disease, it is better to access treatment early. Because one of the things that kills patients is that they do not access treatment early enough. Some of them stay at home, they try all these different agbos that our mamas used to give us. So when they try all these things and they see it's not working, it's at that time they now say, let us go to the hospital. And at that time it will even be too late. So people suffer heart attacks, suffer strokes. So when people see these signs like the chest pain, palpitation and the likes, it's better to straight up go for medical checks, and when they are diagnosed, let them go for treatment right away.
We are well aware that you are a heart warrior. Can you tell us what your element is and what were the signs you observed?
Good afternoon. So my element is supraventricular tachycardia, palpitation, drama, arrhythmias. I think I've been having the symptoms since I was in secondary school. I think I was about 10 then. I go to the clinic every day, I'm having chest pain. And they're like, oh, she's just lying. I was in the boarding house. So I went home too. You are not serious. So it went on for so long. I think about 4 or 5 years ago, I started working in the corporate firm. I couldn't stay on the job because I was having crazy symptoms every now and then. Dr. Majakodimi was mentioning about palpitations and he asked somebody, I'm actually the person. I've had 2 pregnancies. My last pregnancy was crazy with the condition. Like, you can't do anything. I've had to go into his clinic on a Sunday and I wasn't having it because I was in pain. My chest was palpitating like I think I did 227 at some point per minute. So imagine you are going at that rate, but you are working, but you are a walking corpse because you can't make job what you are going through at that point in time. So finding out about this condition in Nigeria was crazy, was scary. But with people like him in the system, it's not cheap. I won't lie, it's not cheap. But I'm alive. The money, we'll talk about that later. So the Nigerian factor is there quite all right, but with this facility, I've been able to have a better life. Every medication you take most times have a side effect. Amiodarone, I don't think about it, even that money right now. Because when you know your liver is exposed, your kidney is exposed, and you tell me to use that drug every day, it's hard. But what do you need to do? Just keep going for checkups, know your symptoms. I always have constant chest pain, constant headache, migraines and the likes. And it was through early detection that now I can sit down here and laugh with everybody right now. I've been up since 4 a.m. If I was not on medications, I can't even try it. So the Nigerian factor, we can't overemphasize that. It's not cheap. But will you say it's not cheap and you want to die? If you die, that's the end of the story. So you have to just keep working around the clock to find a way around it.
I'm Mrs. Victoria Aransi Ola.
And what can you say about today's program?
Today's program is eye-opener to people and the lifestyle. And not everything you believe, you hear, you believe. But believe in yourself and your doctor and meditate and make sure that you eat in a proper way. You use recommended drug. Don't use it because a friend has introduced something to you, you want to use it. Secondly, hypertensive patients need to use their drug properly because everything heart is an engine to the body. And when you maintain your heart, you will surely live a healthy life. So.
And please now, can you tell the people watching at home what you've learned about this program?
I thank God for the life of those people that organized this program. They've done the best. And I learned that sometimes when you know how you are, you don't exaggerate. Secondly, if your parents have died of something, don't believe that that's what will kill you. When my grandfather died of stroke, because of that, you are expecting to die of stroke. It's not so.
I'm Ayatino Mitegun, I'm founder of Kada Community. I'm also a heart warrior. I'm living in pulmonary hypertension. It's a very nice that affects the lung and the heart. I also have a congenital heart defect, atrial septal defect, ASD, usually known as hole in the heart. So I think that's it.
And what can you say about today's program?
Okay, today's program is called the Heart Dialogue. The Heart Dialogue is a program, it's an event to commemorate with the World Heart Day, which takes place every 29th of September annually. The World Heart Day is an event to raise awareness, a global event to raise awareness of cardiovascular disease and cardiovascular health.
And what advice do you have for the viewers watching us at home when it comes to their health?
Okay, from my own perspective, from my own view, I always go for a test, always check yourself. If you haven't had disease, early diagnosis is key, so you can get the right treatment. So do not wait, because a lot of times you may not have any symptoms. So just always go for tests, always know your numbers, always check your blood pressure, your blood sugar level, your BMI, and your cholesterol level. Thank you.
Can you please introduce yourself, ma'am?
I'm Alaja Silifat Akinyemi Eshilokun.
And what can you say about today's program, ma'am?
It is very educative and interesting because so many things that we take for granted, we've been able to know that we have to live a good life. Apart from our nutrition, let us even talk about nutrition for instance. We have to be very careful of cholesterol, be careful of all these junk foods, and so many things that we just think they don't matter. They really matter a lot. That is one. Another aspect, when you feel anything, please don't self-medicate. Go to the hospital, go and get a proper diagnosis, and then know where to start from. Then with that, maybe you can be salvaged.
And hope you really enjoyed the program.
Very interesting. I hope it continues.
Thank
you. To your elbow.
Thank you very much.
Okay, you're welcome.
Today's program has been impactful, educative, and very informative, which is the most important thing.
As the organizer, how do you feel today?
I must be very sincere. I feel so delighted, so happy that people have turned up for this event. In fact, from the bottom of my heart, I want to say thank you to everyone who has turned up. Do I start mentioning names? Okay. To mention names, I want to especially appreciate my own mother, Alaja Sifat Akeme Shilokun, for turning up to support her own, and also Madam Victoria Aronsiola. She is also a mother. She showed up. Then all our speakers, Dr. Tosin Onosoya, Dr. Linda Chikelu, Coach John Anene, Folashade Babatunde, then in absentia, Dr. Tosin Onosoya, who sent our representative. I want to especially appreciate all of you. And then our moderator, Augustina Emele, she actually performed well. And then everyone who has turned up, despite the heavy rain, people beat the rain to come to this event. You cannot imagine how happy I am right now. I want to say thank you to all of you, and I hope that you keep to your promises of maintaining a healthy heart, right? Watch your nutrition, and we'll get there. Thank you. ChaRLianTV. Keep watching ChaRLianTV.
I like that.
ChaRLianTV. ChaRLian.